knee pain can be this muscle. You can see the red arrow there. It's pointing towards the inside of the lower thigh there. It's right beside the knee. This is vastus medialis, and it's one of the muscles, one of the quadriceps group muscles. It can cause a lot of problems in the knee, in and around the knee. Today, I'm just going to talk about the muscular side of things in regards to how it can become problematic. So if you are a person that cycles, if you're a cyclist, if you're doing a lot of hills, jumping sports in particular, for example, volleyball, basketball, if you do tons of squats, a lot of like leg exercises, this muscle can become an issue over time if you're not taking care of it. So how does this happen? This muscle tends to become weaker than the other muscles around the area. So typically, this muscle tends to become weaker than the vastus lateralis, which is another one of the quadriceps muscles. The tissues on the outside tend to tighten up, and this one has a hard time in regards to pulling on the kneecap, which we'll talk about in regards to tracking issues. So the first thing that can happen, and it's a very typical one, is just a minor strain. You can have a strain of this muscle. You might have overworked it, done tons of squats, and you might be laid out for a couple of weeks. You might have to adjust your training. So that's the number one thing. Again, this is not all the problems that can happen. I'm just talking specifically about three things when it comes to the muscular side of things with this muscle. The second thing is the trigger points that can happen in these muscles. So you can have these knots that can happen in the vastus medialis muscle, and the typical referral pattern is into the kneecap. So you'll feel pain in the kneecap itself, and you'll be trying to stretch it out, and it's kind of very difficult. If you've ever had treatment on the vastus medialis, you know how painful it can become. You can definitely feel the referral if there's trigger points in there. When I push down into that muscle and get to that trigger point, typically the patient will tell me, wow, I'm feeling it to the knee, and it can be very, very intense, especially if you've held on in regards to treatment for a long time. And finally, the third way that this muscle can become problematic is that it can cause issues with tracking of the kneecap. So the patella, you see the redness there. So what that means that when you extend your knee, for example, when you're going on the up phase of a squat, or you're jumping and you're straightening out your legs, that's knee extension. And what should happen is that the muscles should be able to keep the patella in a particular way when you're extending the knee. There is a groove that it sits on when you're extending the knee, and it should sit there properly. If the muscle is weak, particularly this one, which typically can become very weak, is that the muscles on the outside tend to pull the patella or the kneecap towards the outside, causing pain. So if you're noticing that when you're jumping, when you're running, in particular when you're extending your knees or landing, you're going to find pain in the knee. And that can be because of patellar tracking issues. And I suggest you go in and maybe visit a physio, visit like a therapist, and discuss this potential issue. So those are three muscular ways that this muscle, vastus medialis, can cause pain in the knee. So if you want to basically go on with your training, if it's hindering you in terms of being able to do the proper exercises, or training for a cycling event or a running event or whatever, give us a call, and we can discuss potential treatment for your knee. By the way, on our website, ventepainrelief.com, we've made a number of changes. With our blogs, we've added a written format to go along with the videos. So you can go back to our website, ventepainrelief.com, and you'll see there's a write-up with many of our blogs. I'm still in the process of writing more up for the other blogs, but go visit it, and you might find some information that might be helpful for you. My name is Alfie Vente. We'll see you in the next video. Take care.